You are listening to Love Your Practice with Dr. Laura Mock. I'm a general dentist, a practice owner, and a certified life coach. I teach women who own dental practices to lead with intention and literally fall in love with their businesses. Keep listening and you will see how learning to love your practice turns into loving your life too. Hey ladies, have you ever been in the middle of a clinical day when your assistant or your hygienist or someone who works for you does something that you want them to do a little bit different, or maybe a lot different? Maybe you're a little bit irked or you're furious. Either way, I have felt the pain of being in the middle of taking care of humans and not being able to take the time right then and there to be the manager as well. And then what happens typically is we get to the end of the clinical day and we still haven't talked to that person about what we want them to do differently. And there's two reasons for that. One is because we really are busy. We really are. But the other one is that there's reasons our brain will give us not to have that conversation. It's uncomfortable. And we don't know exactly what we're going to say or how we're going to do it. We don't know how to have a conversation about positive changes that don't turn frustrating for the recipient or for us or both. And the thing is that I have had so many clients come to me and complain about this problem that I have actually made a course just for you female dental owners, and it doesn't cost anything at all. I made it for you for free. It's deeper than I can go in just a podcast. So what I did was I put the whole course together in a little online bundle, and all you do is text me to get the course. So I have this number set up. It's 66866. Such an easy number to remember. And you just text the words "love your employees" to the number, but you can't leave any spaces between the words or it won't come back correct. I don't know what you'll get if you leave a space, but so your autocorrect will want you to leave spaces there. You got to go back in and delete the spaces. Love your employees to 66866. And the next time someone does something in your practice that you want to change, you will have a very easy system that smooths out the speed bumps that our brain wants to put in place for us to not do the thing. But trust me, I have helped many women do this before. It's a tried and true plan. I use it myself. Text the number, and then I'll see you in the course. Hey docs, Dr. Laura Mock here again to talk to you about owning your practice, loving your practice, and how it's possible right now, even with your practice exactly the way it is, to start to love it. And this is what I do as a life coach and a general dentist. I teach women how to love their dental practices. With me today, which I will be introducing in a moment, is Dr. David Galler, who is a teacher of a course called Reingage, which teaches general dentists to simplify their Invisalign process. And he has a special like artificial intelligence inside the Invisalign program that you can use after you've taken his class to make your treatment plans a lot more simple for a general dentist with your own general dentist limitations and things like that. And I just have had so much fun learning from him, but also mostly I have him on because he talks about mindset and practitioner wellness, and does a lecture on job satisfaction and also just basically being mentally well. So enjoy this podcast episode. It does include some swears, not some big ones, but just in case you've got kids in the car, skip this one and go to the next one. Okay, ladies? Thanks. Okay, I would like to welcome to the podcast Dr. David Galler. Dr. Galler, thank you so much for taking the time. I know you're a busy guy. I know you're in demand. You do all those different things. Thank you.
My pleasure. I'm excited to be here in beautiful Puerto Rico. This is a fantastic location for this podcast.
And he's being sarcastic, which anyone who's listening should probably get used to. You're in snowy Vancouver, Washington. I mean, Vancouver, BC, aren't you?
I am in Canada today, coming at you from our igloo. But we got super excited for this. We have the Wi-Fi up and running, and something you and I have been talking about doing for a long time. So I'm excited we got a chance to do it.
I know. I'm excited too. I'm sorry that it wasn't Puerto Rico. That's where it was going to be, right?
That was the
Originally.
original plan, but
Yes.
thanks to that hurricane in October, that was no longer feasible.
Right. And anyway, it was actually a really hard date for me. So I was kind of secretly glad when it got rescheduled.
Yeah, I was wondering why the hotel gave us such a low rate for those October dates. I was like, $200 a night. We're gonna run a program there, and then basically for those who don't know, basically September, October, November, you can't go to Puerto Rico. Like a hurricane hits it like every other week, and this year they got a real whopper of a hurricane, which is why if you ever go to cruise or vacation in Puerto Rico in September, October, November, it is like bargain basement suite, with like $100 a night or $200 a night. And I thought I was just
Right.
a
Take your
genius, but
chances. We'll see. Maybe it'll be
yeah,
okay. I don't know.
I'll stay home.
Yeah. So, for anyone who does not know, Dr. Galler is a general dentist and teaches general dentists how to do Invisalign in a more predictable, um, simplified. Can I say simplified? That's not insulting, is
Yeah, a
it?
simplified, systematic way. There's, with
Systematic.
philosophy.
Yeah. Yeah. So, and I went to your class this summer. I had heard about it several times because I am a BioClear person. And so I'd been to several BioClear classes and everyone was like, oh yeah, I'm a Gallerite. And I'm like, what's that? What, tell me more. And so of course, then I had to wait my turn to go to your class because it always gets filled up. I went to your class and I just drank your Kool-Aid, but it tasted really, really good.
Awesome. No, it was great to have you.
Yeah, and you just really simplified and clarified some concepts for me and helped me to understand what not to touch, but then also all of these patients that I could benefit and how. So thank you for that.
My pleasure.
But we are not here to talk specifically about orthodontics today. We are here because during your class, you got into my favorite subject, which is mindset work, or like looking at what is happening in our brains and seeing how it is helping us move forward the way we intend to, or stopping us from moving the way we want to. And so I want you to tell me about your theory about what happens in dental school. For example, why we don't do ortho, but more generally as well. What is happening? Why do we all believe that we suck?
Yeah, it's a funny game, and it took me about 15 years of practicing before I turned around and I'm like, I'm not the only one who like walks around just kind of like a nervous Nelly all the time. And you start talking to other dentists, and I meet about 50 general dentists a week, let's say, through WhatsApp or through conventions or conferences. And so many of us, like I could have gone to medical school, like I had the grades to go to medical school, but everyone around me was like, don't go to medical school because healthcare is taken over and you'll have no quality of life. Go to dental school because you'll have an awesome quality of life and you'll be super happy. And then my dad's a dentist. He's like, yeah, don't go. Because I was like, I'll be a cardiologist. I thought the heart was cool. But everyone's like, no, you'll be in medicine. You'll be in hospitals all the time. You won't have any quality of life. Go to dentistry and you'll be super happy. And I'm 15 years into it. And I'm like, nobody's happy. I don't know any happy dentists except for ones who sold to a DSO and are just retired now. Everyone else who's seeing patients day to day is pretty nervous, anxiety ridden. And you wake up one day and you're like, is anybody happy? And you rarely find, dentists that's happening. And it's a shame because this is a beautiful profession. It makes a great living. We get to make our own hours. We help people. Thankfully, nobody dies or is like, dead because of a decision we made. And yet the day-to-day dentist is like worn out. It's
Mhm.
crazy. I don't know many dentists that come home every day and just have some big smile across the face. And the question, let's just chat about like why? Where does this come from? Why? How can we all be miserable?
Yeah. I mean, let's talk about school. Let's talk about how we were trained first, because as a life coach, I look into the habits that we have in our brains. You know, a brain's just an organ. It sits between your ears, and its job is to tell you what's happening in your environment and then filter it to decide if this is good for survival or bad for survival. And as we bring in all this data, our brain gets a little bit overwhelmed with all the things. So it starts to make habits or pathways, we call them neural pathways, where we think the same thing over and over and over again. And while we're in school, let's just name some of the crappy messages that we got from dental school. I'll name one and then you can name one. How about if there is a complication, it's because you did something wrong.
Yeah, that'll do it. I mean, listen, I went to Penn, so it's an Ivy League school. And looking back, I say I got a good education. I was happy when I got out first year and I was with other residents. I was like, I know more than you. I did a lot of clinical. I felt good about it. But in school, I remember being in pre-clinic and they just showed us how to cut an MO. And I cut one. It looked like it should for my first MO.
Mhm.
And the instructor was like, whoa, you suck. This might not work out. And I was like, oh shoot. And then I cut another one and he's like, yeah, you suck. It's a 3 millimeter box. And we specifically said 1.5 millimeter. And I was like, oh shoot. And then they were like, I cut one and it was like 2-ish. And he's like, yeah, I don't know if you're getting the hang of this. And the dental school mentality throughout, and specifically this pre-clinic, and which I hated, was you suck, you suck, you suck, you passed, great. And that, let's say, you break up your dental school class into 3 parts, which is what I always tell everyone. 20% of the people, like, okay, you're like a Michelangelo. I don't even know how you knew how to wax up a central incisor. Like, okay, you're just an artist. Good for you. We could both draw pictures of people, and mine would be a stick figure and yours is like a portrait. Great. And then you got your 20% of people, and I'm like, you missed clinic, you forgot to come, you didn't bring your supplies, you don't even know what we're doing today, you were supposed to get this checked off and you didn't. So let's take out those 2 sections. The rest of the people are like 60%, and that's where most of dentists fall into. And I was like, you suck, you suck, you suck. I don't know if this is going to work out. All right, this crown looks okay-ish, and you have a retention groove, so nicely done. And then you pass. But that mentality of like, you're terrible, you're terrible, terrible, I think it stays with us. Like hearing that you're bad. I remember putting a file into my first root. Like, it was like terrible. I got like a half an inch. I think I was like halfway down the canal and I thought I was done. This is the day before Apex locators. And the instructor came over and was like, this is terrible. We haven't even gotten close to the nerve. And I was like, I don't know where the bottom of this thing is. And it just makes you feel so bad that first time. I think there's some trauma that stays with you.
Oh, do you ever have dreams that you're back in dental school or like it's boards day or something? I do.
Absolutely. About 2 to 3 times a year, I go to sleep and I'm in dental school and something is going horribly wrong.
Yes.
Like I can't get my handpiece to turn on. I can't find the lecture hall. My patients, I'm just drilling, and I never get to the caries. And I have a sister, her name is Dana. She's a psychologist. She's a board certified psychologist in NYU in New York. And I told her, I'm like, Dana, 2 or 3 times a year, I go to sleep and I'm thinking, she goes, when you dream, are you really there? And I'm like, yes. And she goes, when you wake up, are you like sweaty and out of breath and nervous? I'm like, yes. And she goes, does it take you like 10 or 15 minutes to realize that you've already graduated and you're board certified and you're actually a success? And I'm like, yes. She goes, we have a name for that. I'm like, what? She goes, it's called PTSD. She's like, what happened to you there? And I was like, I can't talk about it. I can't talk about it.
Well, this is perfect because this is exactly paints the exact picture I'm trying to always explain to my ladies, where we get into habits while we're in dental school and then we carry them into private practice. And those shameful thoughts, I suck at this. I hope nobody knows how much I actually suck. They talk to us while we're working on in the clinic. And oh my goodness, I just nixed the tooth next to the one I'm working on. Or my Invisalign case has a posterior open bite, or whatever it is, it automatically goes back in your brain, goes, see, you suck.
I've told you.
And that hurts you. And it also hurts your patients because then you don't recommend treatment that you actually do know how to do that could help them, but you're not saying it because you don't feel confident.
Yeah, it's weird. Even 25 years later, whenever I remove a temporary crown on a tooth and I hear a crack, like a suction break, somebody in my brain goes, "You broke the prep. Nice going, Dave. Nice going." Because one time, like in 1999,
Mm.
I removed the temporary crown and I had a real skinny abutment and I cracked the abutment off in the temporary crown and it started bleeding. I need a root canal, I need a new core. Ever since that day, there's this voice in my head. I'm talking like every time I get the crown remover and I remove a temporary crown, right as I grip it, somebody in my head goes, "You're about to break it because you
Mhm.
suck."
Mhm.
And I can't shake that guy.
Well, it's definitely in there. So the life coach in me would congratulate you for knowing that it's
So the best way I have to deal with it, and this is what I've started to do to deal with that, is I stopped doing crowns.
there. Well, I mean, I do a lot fewer crowns than I used to because I do the BioClear thing now. But that aside, most of us can't just stop being dentist. We already bought in. We are $1 million in debt.
Yeah.
And we are running on the hamster wheel and trying to do the insurance game or whatever. So we're on the struggle bus sometimes. And I'm just over here, we're talking about how these thoughts got into our minds. And the thing is that you did this thing in Reengage that I really appreciated, which is that you gave me new thoughts to think. You gave me some new ways to think about what I do as a general dentist as it pertains to Invisalign. And that's why I wanted you on here. Like, do you teach that class every week? So just tell us some of the things that you told us just about orthodontics that help us to feel more confident in what we're doing.
Yeah, I mean, in dental school, you're told, don't talk ortho, don't, it's not your plane, don't do it. When an instructor came over to me and be like, "Hey, David, what do you see?" Like if I was like, "Hey, I see a class 2 malocclusion with huge overjet and, a narrow arch," he'd be like, "Oh, thank you very much, Mr. Fancy Pants. Why don't you write a paper on it and mail it in?" Because orthodontics is not focused, it's not even looked at. I mean, I regularly have kids coming through the course who graduated 2020, 2021, and like, has it changed? You have a patient in your chair, you just spent 4 hours doing a prophy and a medical history, and now the instructor's coming over for an exam. Did at any point they ask you what molar occlusion is there? Is there a cross bite? Is there an open bite? Is there crowding? It's not even, it's considered faux pas, but everything relates to it. Oh, you have bleeding on probing on your lower anterior teeth. Yeah, it's because they're overlapped.
Mhm.
Okay. Oh, what do you have an abfraction? Yeah, it's because your teeth are pointed towards the lingual. Yeah, does this front tooth chip off? Yeah, it's because you have a class 3 and you're trying to put a big lower circle inside of a upper bigger circle and you have a traumatic occlusion here. And it's going to keep happening no matter what bonding agent you use or what prep style or retention groove you put in. But there's just not this focus. And there is no dental school in the country that has a ortho first focus. And what I teach everybody in the course is you're a slave to that system.
Yes.
And it's hard to break out. See, what I couch it with is, you take the course and I'm like, boom, this thing's blowing up. You should be doing Invisalign in your practice, and everyone kind of is in their head. And I'm like, you got to diagnose every patient. And what everybody says back in their head when they're listening to me is like, not every patient, David. Because I don't want to be like salesy, because Invisalign is salesy. It's like whitening. I don't want to tell 6 people in a row they got to give me $5,000. But the only reason we think like that is because of dental school.
Yes.
That's
Yeah.
it.
Mhm.
The only reason we don't care, we don't like, people say, "Oh, I care about, but you don't really, like, if somebody has crowding and you're like, "Do Invisalign," they're like, "No way." And you're like, "Cool, see you in 6 months." Because we don't really value it. And it's a shame. It's really hard. I struggle with it sometimes because in dental school, I was told caries, perio, cancer, caries, perio, cancer.
So, you were talking to us in the class about how it's so easy to say you need a root canal and a crown on this tooth,
Yeah.
and if they say, no, I don't want to do that, you're like, no, seriously,
Yeah.
do you, no, don't walk out yet, because you
Yeah.
might end up in the emergency room with an abscess and I can't let you do that. Please
Right.
listen
There's
to,
this urgency on it. This
yes.
urgency on these things that we know, this big MO.
And I feel
You
confident
can't
about it. I
do
feel confident that it's true, that
Right.
they would benefit from the treatment, right?
Yeah.
But then if I have someone who's like, super narrow palate, deep bite, crowded, maybe the lower anteriors are like up on the palate, whatever. And I'll be like, oh, you could straighten these.
Cute. Wouldn't it be cute? Wouldn't it be cute to do Invisalign? Wouldn't it be fun? You'd be so happy. We're here. Look at Tina. She's wearing it. Oh, look, we're running a special $500. Like we should, Laura, you and I, we should walk into a room and go, oh, lower crowding. All right. Take pictures. We're doing Invisalign.
Yeah.
I don't want to. What do you mean you don't want to? You have your teeth are not correct. They're not in a circle. They're supposed to be in a circle. Yeah, no, I don't want to. Listen, I'm sorry, but this is I can't let you walk out with a broken arm.
Important. We got to
It's
talk
crazy.
about this. We
Yeah,
gotta
like
talk about how gum disease gets worse because you're crowding, and gum disease also causes heart attacks. So let's talk about this, and that takes a shift in the mindset. And I loved how you went over that in Reengage. And you didn't say to us, I'm going to help you with your mindset, but I knew that's what you were doing. And I just really appreciated it.
yeah, I mean, listen, I'm speaking for myself. It's it's easy for me to speak about because I know I struggle with it. I'll come into a room, see a giant, occlusal cavity with a giant hole going, and I'm like, root canal time. And like you're like, I can't afford it. I'm like, root canal time. You're like, I'm going to Italy. Root canal time. I don't feel any pain. I'm like, there's nothing you're gonna say that's gonna change me. But like on the Invisalign front, I become like a clown. I'm like, look at this picture, look at that, look at this. I could do this. Look at this before. Like I'm so salesy,
Yeah.
because I'm not confident. And the reason I'm not confident, I'm not saying I'm not confident. I've done thousands of cases. Is that I don't value it the same way I do, and it's a struggle. And I'm talking to myself, and I teach this stuff. I value caries, perio, and cancer. I have to really work hard to value ortho, and I blame dental school for it.
There's another thing. I completely agree with what you said. And there's another like side of that, which is that when I'm telling someone that they have cavities and I can fix them with fillings, I feel like I am helping them. I am doing them a favor. But when I ask them if they want to do Invisalign with me, it's almost like I'm asking them to do me a favor because I'm not thinking about it in the way that benefits them. I'm thinking about me, and that's bad sales.
100%. And people could sniff it on you in a second, Laura.
Yes.
The number one thing I hear, and I like to speak to so many of my students before and after classes, and people come before and after, they're like, oh, I'm doing consults. No one's saying yes. It must be the inflation or the recession or this or that or Biden or Trump or blah, blah, blah. There's so many good reasons why. And I'm like, no, it's you. There's something in your voice. I know that you're saying Invisalign and this, but there's something in your voice, something in the way that you're saying it. Patients picking up, this is cute. It's optional. It's nice. It would be nice to do this, but I'm going to Italy, so not right now.
That's so good. I tell my clients to start their day and ask themselves how they can help or who they can help, and to focus on thinking about ways that they can improve the lives of their patients through the skills that they have, instead of thinking, today I want to sell one Invisalign case.
Right.
And if you
Right.
just do that, if you just offer people what you know how to do, you're definitely going to be doing more Invisalign. But
And I think you'll enjoy it more. I think you'd be surprised when your consult is from a place of confidence and I really want to help you, people just say yes. You know, I understand finances, finance, people always throw finances, finance, finance. But what I teach in bigger courses is people will spend money on things that they value. If you value it, and by turning back, and the best example, as I say, you know, we have a room of like 100, 200 people there. Sometimes staff, sometimes, and I'll call on somebody and I'd be like, do you have a phone? And they'll pick up their iPhone and it's like iPhone 11, 12. And I'm like, scenario, you went to the bathroom, you come back, your cell phone's gone. It's not on this table. You look right, you look left, you look pocketbook, you look back. You live in Denver, we're in Chicago. You're here for the weekend. Are you going today to Verizon, to T-Mobile to buy another cell phone? 100%. It's $1,100. Your warranty just expired yesterday / blah, blah, blah. It didn't cover this, that. Will you drop $1,100 today for a new iPhone? 100%. Everyone's like, yeah, I would leave this course in the middle, get someone to Uber me to the place, and I have an iPhone in my possession by nightfall. And I'm like, did you plan on spending $1,000 today? You're an assistant, you're on $15 an hour, $20 an hour, you're on a fixed budget. Nope, wasn't planning on it, don't have the money, but there's zero chance I'm going to go a weekend, much less a week or a month without an iPhone. You take away someone's phone, you'll be like, buy a new one. Nothing to talk about. I don't have the money. I'll borrow the money. I'll space it. I'll figure it out. If people have, why do people do it? Because they value the cell phone. I can't exist without a cell phone. If they translate that to their teeth and their health and their alignment, nothing stands in their way. If you value this, people will say yes. And people could sniff it on the dentist, whether the dentist values it or not.
Yeah. So if you're thinking as a dentist that Invisalign is something that you can do just because it looks pretty or because it's fun or whatnot, then it's going to be a lot harder to enroll your patients than if you're thinking of this as a life-changing service, which frankly, a lot of times it is.
Yeah, and there's nothing wrong with doing cosmetic cases. So, I mean, sometimes I see people coming around and their teeth, and I notice them across the room, and I'm like, I got to be honest, you're a beautiful person, but if I could just align these teeth, you will increase in your level of confidence for, you know, the health, you know, depending on the patient. You know, sometimes people are like, oh, I'm not cosmetic. I'm not, but I do sometimes. Listen, I know what happens when I straighten your teeth. When I pull that canine back into the arch, I know you're very confident, you're successful, and you went to college and you're already married and you have a job. But I'm telling you, I pull that canine in and she wraps around with the other ones. You're gonna be a different person, and I know what can happen. And I'm pretty confident in my presentations. I'm like, I could change your life. Like with this thing, I always think about, you know, these people on you ever watch that show, The Biggest Loser?
Oh, yeah.
So for the audience who doesn't know, it was a show, I don't even know it's still on anymore, but they used to find these people that were like 600 pounds, you know, really just had lost their way. And they just feed them salad and make them run on a treadmill for like 8 weeks. And like, they lose like 300 pounds or something like that, or it's crazy. But you just see this like happiness in them at the end. And it's overwhelming to me. And I'm like, I have that ability. I have those skill set to do for people with their teeth, you know, and why wouldn't I want that for you?
Yeah. I mean, it is kind of amazing because we know a smile is so powerful. A
So
smile changes so many things in one person's life. And here we are in an industry where we get to help people with that every day. It's super freaking awesome.
yeah. And listen, my dad's generation of dentists, you know, if they wanted to do the same thing, it's a lot. That's a, you know, you're losing enamel.
Yeah.
Now you've got porcelain on it, some of it's staining. 10 years later, we're seeing a little bit of a gingival margin, a metal, you know, even on the BioClear. If we're going to remake your crowding with BioClear, it's going to crack. You know, it's a lifetime of watching over some of this, the stains and stuff like that, when you're trying to fix teeth that are in the wrong position, you know, cosmetically. And now, so a generation ago, my dad's generation, they didn't have this skill set.
Mm-mm.
Now I have the skill set. I just got to put plastic in your mouth. You
Yes.
wear it, and I
Mhm.
can change your life. It's such a valuable skill. I would do this even, you know, even if I didn't need to for a living, I would still want to do this procedure.
I agree. I think it's so fun and amazing. By the way, we've sold 6 cases since I came home.
There you go. 6 new happy smiles. I love it.
Yeah. Yeah.
Well done. Well done.
So fun, so fun. So let's talk more generally again, because we've talked and we talked about this before we started recording about how dentists are just in general, they are not happy with their careers. You know,
Yeah.
there is a whole industry, coaching industry for helping dentists get out of clinical dentistry and do something else because they go through all of this time and so much effort. Oh my gosh, so hard to become a dentist. And then they get here and they're not happy and they either leave or worse yet, they stay in and just slog through their days over and over and over again. So, what is
Or worse yet,
causing this?
they pick up, they pick up some habits, which we're known for,
Oh, yeah.
stress relief habits slash the ultimate. And we really lost a real important person in academy last year. Everyone knows some dentists who just, the
Yeah.
darkness just took over too much.
Yeah. That
And it's a
happened.
shame. It's a shame.
That happened to two women here in Iowa during the pandemic.
Yeah. I think the most important thing that I always, and this is a topic that's like you, Laura, is very dear to my heart. I only lecture on two things. I lecture on Invisalign, and then about 3 or 4 times a year, I'll lecture on dental happiness. I'll do it in Colorado in January. I'll do it in Florida in June, just part of the convention. And I don't have any coaching. It's just something different to my heart. But whenever I start this topic, or whoever's listening, everyone who's on the call or listening to this, wherever you are, just know whatever thoughts you have in your head about this is overwhelming, I can't handle this, I'm the only one, why does my practice suck? You are so not alone. You are so not alone. I've achieved great success in my practice and my career and have, a lot to be thankful for and known around. And I'm telling you, I have those same feelings, those same doubts, those same anxiety, that same worry on a daily, weekly, monthly basis about my practices and my patients.
Mm-hmm. But why? Why?
So I'll throw out some theories. I don't have it all pinned down. I know that we're all the same. I know that the most talented dentist and the least talented dentist, I know the dentist that's grossing 6 million and the one who's grossing 400,000 all have the same fears, anxieties. I have a couple of theories. I'll throw them out. Yeah, you'll tell me which ones you think.
Okay, you do your theories, then I'll do mine.
Okay, well, we're gonna trade punches here. There's a weird thing in dentistry, and that is it is never enough. What, Laura, you have one practice in Iowa. Have you thought about another one?
Mm-hmm.
Oh, sorry, you have two.
No,
Have you,
I was saying maybe two.
yeah. Oh, okay. Yeah. I was like, right.
I only
Yeah.
have
So you didn't tell me.
No.
Yeah. Laura, you have one. Two, if you get four, you might be able to bundle them up and sell them for a 6X to a DSO, and then your children don't have to work. One's cute, but I didn't know that you were lazy. Do you not use a laser? You don't have the BioLace laser or the Opus laser? Oh, I knew you were a good dentist, but I thought you were up to date with what you don't place implants. What? You didn't do a sinus. Oh, you do place them, but you don't do sinus lifts. Like there's this thing in dentistry where whatever you're doing is not, you got 20 new patients a month. Well, if you would have joined Yappy, you would have gone 100 new patients a month. What, you have SEO, you have an Instagram, but if your whole office is not dancing to Sweet Caroline every other day, you're just not putting in the quite effort. Like you go to a dental convention, and I'm guilty of this at the convention because I want people to do Invisalign, but whatever you're at is not enough. It's not enough. You're a gold provider Invisalign, you should be gold plus. You're gold plus, you should be platinum. You're not platinum, you should be diamond. I don't know why we do this to each other. I don't think this happens in other industries. Like I have a friend who's a GI. He goes to GI conventions and every booth is like, hey, here's a new GI machine, or here's a new way that we check for colorectal cancer. It's not like your website sucks, get more patients. You don't have enough patients, open up another GI office, open up 2 more GI offices, open up another 3 chairs in your office to see more patients. It's just like, here's how you be a better GI. Why do we have this fascination with bigger, 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 more patients, more operatories, more offices?
Okay, I have an answer to that. We are singular with maybe some ophthalmologists and some podiatrists, maybe chiropractors. We are singular in the fact that we are the technician and the business owner. And so there's entrepreneurial and leadership duties that we didn't aspire to.
Yeah.
Like when you were thinking about going to dental school, where you're like, and I'll be a manager of 10 people.
Right. No. I
No.
want to be a dentist.
Yeah. And so now this is extra dangerous because of how human brains work. So we got the technician thing where we're like, I'm going to do this perfect crown margin and I'm going to get 6 degrees of taper and perfectly rounded internal line angles and everything. And then there's that. But then there's team members who want to take time off. And then there's the insurance company denying claims. And then there's what you see on social media, which is the same for everybody, except for most of people in their careers don't do that dual role where they're technician and the entrepreneur for their practice. That plus how brains sift information is what turns us into miserable little lumps.
Yeah, listen, I aspire to that. If you speak to your friend who's a primary care physician, who's a doctor, who makes $250,000 to $450,000, and you ask them what their day is like, their day is walking into a room, talking to people, processing information, and reading labs and CAT scans and talking to other doctors. I was like, how about procedures? He's like, I take blood pressure. Every now and then, like, I'll put an IV line in. And I'm like, just listening to people and reading their histories and understanding what's going on and diagnosing is first base.
Mhm.
After that, I got to do microsurgery on your human organs, let's call them your teeth, to the 10th of a millimeter precision sometimes.
While there's a tongue and a cheek going,
yeah, and somebody's spitting on it, plus you're nervous, so I'm trying to calm you down.
yep.
The only equivalent, the level of precision. Now, when I graduated dental school, loops were like, the endo guys were doing loops. But now every Joe and gal has loops, 3040. So we're looking, we're tight on these things. Like we're tenths of a millimeters precision on our preps and crowns and this and that. The only other equivalent medical person who's working at that is like a microsurgeon. Those are people who take blood vessels in your leg, re-sew them up because you have varicose veins or they're doing bypass. That's the only other person working at that level, or an eye surgeon.
Mm-hmm.
All the rest of the medical profession, you know how big the lungs are? Like microsurgeons make minimum $1 million a year for tying your blood vessels and finding other ones.
And I don't think that precision part is what's stressful. I think it's impressive. I think it's cool, but it's the part that you were talking about where it's like, oh, I don't have the right equipment. And I think if I get the equipment, I'll be happy. Or I think if I get another practice, I'll be happy. Or if I get more new patients, I'll be happy. But the thing is that all of our feelings come from one thing, and that is from our thoughts. We have a thought in our brain about, is this good for survival or bad for survival? And then that creates an emotion inside our body. So if we want to actually be happy with our profession, it starts with being aware of what we're thinking in our minds. Are we comparing ourselves to the practice down the street? Are we telling ourselves that we suck? Are we thinking that we won't be happy until the next phase of our lives? That is actually what creates our unhappiness. And it just so happens that when we're doing the dual role, and we were trained in dental school to know that we suck, then we get here and it's like a magical bad combination of factors that creates, like I said, miserable lumps.
Yeah, I agree with everything you said. It's just this fascination with more. You go to dental convention, walk up and down the aisles, and it's just like more patients, more offices, more insurance billing. Hey, better way to remind your patients about their offices. Hey, better social media. Hey, how's your SEO? More. And I'm guilty. I'm on that same train. I'm sorry, but I do the same thing. I don't know how I got here, but I push dentists to do more Invisalign, and I do it from a place of help, I do, but guilty as charged. There's just something about this profession that's I have 2 brother-in-laws. They're both weirdly neuroradiologists.
Hmm.
Just a quirk of, I got my sister-in-law brainy guys, I don't know. But they don't have the same, like, I need another office. I need another op. I need more new patients. They just kind of do what they do and read brain scans and just try and keep everybody alive. I don't know. Maybe we have too much free time because we don't worry about people dying. Like this fascination with more.
Well, the reason that it works to sell to dentists, the reason that we're such good buyers is because we're unhappy, and the people who are selling us things show us,
Oh, they feed
look,
right into
you
it.
buy this and then you will be happy. You buy
Yeah.
this and then you will be happy. And we're like, yes, all I need is a quick solution because I'm miserable. Here's my money, take it.
Yeah. Can you make my website better? Will I get more patients and more reviews if you just do that?
And then I'll be happy.
There are more dental sales people than in any other health. Like if you matched all the dental salespeople against, let's call it podiatry or optometry or ophthalmology, it's 10-1. Maybe they're driving this thing to us.
Mhm.
Something's happening where it's just, you never meet a person who's like, I'm happy. It's amazing. I don't need more ops. Or maybe you are, Laura.
Well, no, I'm raising my hand because I have a question for you. Do you have advice? Like, we've done a really good job of pointing out what the problem
Yeah.
is. What is your suggestion for the average dental practice owner who just wants to go home and feel good about what she did, or be able to be working without that unhappy or scared feeling? What do you tell people? I mean, you talk to so many general
Yeah.
dentists. You talk to way more than I do. What's your advice?
So one thing there's like one easy thing, one hard thing to do. So one easy thing to do, and I tell this to dentists, whether they're 2 years out or 20 years out, and it's quirky and it's weird, but it works. You take a little yellow legal pad, right? Take a little pad, like, that, put it in your desk, cut down the column. One column, you write good, other column, you write bad. Every time you do a procedure that works correctly, crown inserted, number 30, very nice. Number 12, MOD, contacts made, occlusion goo, no sensitivity, no good. You put it in the good column.
Mhm.
Every time something just quirky happens, this tooth has sensitivity, this crown fell off, perio inflammation here, this one didn't work out, I pulped out on this one, you put it in the bad column. And you do it for a month, full January. At the end of the month, you will see that your good procedure column is like 10 pages longer than the other one. And the other one is at number 9 that just keeps tripping and the patient keeps eating ice and you just don't listen to them. When you see the bulk of your work that is exceptional, that you are a good dentist, that you don't break off the abutments when you remove the temporary crowns 99.9% of the time, you'll be like, God damn, I'm a good dentist. I should charge more. I should have, look at these hand skills. Look at all these procedures that worked amazingly. You'll get so much more happiness because our brains are wired to, they call it the remuneration. Well, it's not remuneration. What the word? It's like where you think of all the bad, you just focus on the bad.
I don't know what the name of that is, but we definitely do that. And it's because it was good for survival in the evolutionarily speaking.
Yeah. So, you have 10 crowns that went on perfectly. One came off and you just don't forgive yourself. And you just keep thinking about it and thinking about it and thinking about it. But if you have that secret, just hide it for yourself. Just put it in your desk. And when you just look at that, you go, no. I got some good hands here. I got some good skills. My patients are lucky to have me. I think that brings a lot of people happiness. And then, the second thing, and this is more quirky, is I tell everyone who's a dentist, like, I can't get you out of the rat race. To be honest, I don't know how to do that. I'm in the rat race myself. But I think you should have time for yourself every week for guilty pleasures, like something that you do that makes you happy. And I give people examples like, on a Sunday, like not playing with your kids specifically, not even listening to them, not even talking to them, just letting them literally just watch TV for 12 hours. And even though there's a voice in your head that goes, you're the worst dad ever, you're the worst mom ever, screw it. Yeah. Or if your spouse goes, that's really selfish, I go, it certainly is. Like, I'm going to do this for myself because it's self-care. I tell some people, hey, go running. I don't know if you are a runner, Laura, but some runners, man, they love the run. They come back from a run and they're like, oh, I feel good. I feel that runner's high. Or, just stop at 7-Eleven on the way home and just eat a Ben and Jerry's, whole thing in the car, and then just throw it out inconspicuously before you get home. Give yourself some guilty pleasure every week that is just you. And if somebody would see it, they'd be like, that's really selfish, David. I go, it 100% is. In dental school, my first year out, I used to go to the movies by myself to just calm down. But I had work to do. I had labs, and like once in a while, I would just go to and see whatever movie on my own for 2.5 hours, and it was not fair, and it was selfish, and it wasn't a productive use of time. And I specifically did it because of that. And I try to do something like that every week, and I think that brings me a lot of happiness and gives me kind of a place to go to.
So, comment on the first one, life coach perspective would be you're giving your brain new thoughts to think. And you're showing your brain the facts instead of the brain assuming that everything is terrible. You're like literally going, no, actually, you just look at these facts and look at all these happy people. Then you have these 2 or 3 or whatever that didn't go well. And it just gives your brain something else to believe that's not, see, you suck. So I love that. And the second one, yeah, we all got to make time to take care of ourselves. And whatever that is going to be different for each person. I like the idea of letting your children sit and watch TV. I did used to hide from my children sometimes, but they're grown now, so I don't ever have to make time.
Yeah, just like so overdone in our head. Perfect father, perfect husband, perfect uncle, perfect son, perfect dentist, perfect boss. How about I'm not perfect purposely? And if you saw it, you'd be like, David, that's really selfish of you. Wow, you don't have to lecture till Monday, but you go out to Vegas a day early for yourself, and you just chill when the kids could have used you, or this could have used you, or the practice could have used you for another day. Just to find something in your day, something that you do that is just you. That if anybody would be like, whoa, and you go, exact. If somebody looks at it and goes, whoa, then you go, oh, I finally found something that's good. Yeah. I was supposed to come home 5 o'clock from work. I didn't. I came home at 9 o'clock because I went shopping instead.
I went shopping.
Yeah, that was selfish and nice, but yeah, that means I'm healing.
Yeah. Last year I went to Hawaii by myself.
Love
I
it.
didn't even record a podcast or anything while I was there. I just breathed in the floral air and watched for the whales, and that was basically all I did.
Sometimes I take an extra connection flight just to give myself a break of time.
Really?
Yeah. 100%.
That's fun.
I love planes. I love airplanes. Airplanes are the best to me. I don't understand why connections cost less. You should have to pay more. It's 2 planes.
What's your favorite airline?
Delta, all the way.
Are you Diamond Medallion?
Diamond, high medallion, high. Like I don't have to buckle up when I sit down on the plane. They don't. I know I don't have to lean my chair up when we land. They're like, oh no, he's David Galler. He doesn't have to do that.
Oh, that's amazing. I'm just excited because this year I am platinum.
Very nice.
Our ladies
75,000.
really don't care about that, but platinum medallion, I'm getting there. So
platinum solid. Platinum solid.
Yeah. Well, this has been fun.
Great. Yeah, excellent. I really hope your listeners get a good laugh, and just know they're not alone.
Yeah.
All really are. I don't from so many different age groups and cultures and parts of the country. You're from Iowa, I'm from New York, but somehow we all became kind of the same person.
Yeah.
And I think it's refreshing for dentists, if nothing else, to just know, no matter what you think is going on in your head, I promise you, everybody's feeling the same thing. And the one person who's Instagramming how amazing their life is and how perfect their dentistry is usually the one who's the most stressed.
Mm-hmm. That's very true. How do ladies, how do they find your class, your Reingage class?
So the Reengage course is really, it's where you learn how to do Invisalign. It's like the best kept secret in dentistry that we're all doing Invisalign, but nobody knows how to do it. We're just not great at teaching it. From the Invisalign. Everyone gets a certificate, and then you're like, what? I'm an orthodontist? So this is the course. It's on, if you go to the American Academy of Clear Aligner website, that's www.aacaaligners.com. Just Google it, American Academy of Clear Aligners. You just click continue education, and they sponsor all the courses. So they teach the Reengage course. I am the sitting president right now of the Academy. So they do that. We have a couple of different courses out there. We take everybody and we have a good time, whether you want to do Invisalign or not. It's just nice. It's a fun 2 days.
Yeah, for sure. Yeah. And when I went, I actually was a clear correct provider. So you converted me over though.
All good, clear aligner, teeth are teeth, ortho's ortho.
All right, we're going to sign off, ladies. Thank you so much for listening in, and we'll see you on the other side.
Thanks for listening to my podcast today. I'm Dr. Laura Mock signing out. Remember, if you want to take that free course on correcting your employees, text the words "love your employees" with no spaces to 66866. Thanks, ladies. See you next time.
Thank you for listening to Love Your Practice with Dr. Laura Mock. I would love to meet you. To join our movement, find the Facebook group called Love Your Practice and request to join. If you can't find it, just send me a message and I'll add ya. You'll find me there helping all of my ladies to fall in love with their businesses and have a better life.